So is it possible to avoid these knee replacement surgeries or other knee surgeries? The short answer is yes. The number one question people have is it possible to actually avoid knee replacement surgery? First, it's helpful to understand that there are many different types of knee surgeries. There are arthroscopic surgeries or clean out surgeries where they may go in and remove some of the arthritic change. There are meniscus surgeries where they may go in and repair or even cut out areas of meniscus that are torn. And there's also replacing the entire joint overall. More minimally invasive knee surgeries may give people relief for a short period of time, but more often than not, patients are experiencing return of pain symptoms, and sometimes their arthritis even gets worse. Plus, there are also increased risks with knee surgery, such as infection, scarring, loss of motion, extended rehabilitation times, and extended time off of work or away from your normal life activities. So is it possible to avoid these knee replacement surgeries or other knee surgeries? The short answer is yes. Ultimately, it may depend on how severe your knee pain or arthritis actually is. There are several conservative treatments that you can utilize that can help with reducing knee pain and also help with impacting improvement in function and just making you overall stronger and more fit. Things like losing weight or going through some additional physical therapy to help with improving muscle strength or mobility can be very helpful for reducing pain symptoms and helping with daily function. Also, maintaining a baseline healthy diet can help with actually reducing inflammation in the body as a whole, and that can help with reducing pain from arthritis all throughout the body system.